So I just saw a post that made me question my entire career. I'm Dr. John Cybulski. I'm a chiropractor for almost 15 years, and I'm here with Dr. Bobby Riley, also a chiropractor for almost 15 years. And I found a post that apparently chiropractic is a pseudoscience. So we're going to watch this post and hopefully defend our entire career choice or have an existential crisis. I don't know. You'll find out. Welcome to the Anatomy of Therapy. This is the post I'm talking about.
Why am I only just learning that chiropractors are not real doctors? Yeah. So, chiropractic is a $15 billion industry, and it was invented by a guy named D.D. Palmer who thought that ghosts were telling him to create it. They believe that the joints and the nerves that go through our body are the cause of every ailment that we know of. Unfortunately, chiropractic is a full-on pseudoscience. There are certain chiropractors that maybe stay in the lane of more physical therapy, and there's a little bit of data to suggest that for certain types of low back pain, chiropractic adjustment can offer temporary relief, but it's not fixing a musculoskeletal problem, and it's definitely not doing the other things that chiropractors claim to do. So if you see the abbreviation DC after someone's name on social media, that means that they're a chiropractor and they're not a medical or scientific expert.
What the heck? I have to quit my job, I feel like now. Or is there some merit to she saying? Is there some nuance in there, perhaps? Bobby and I are going to talk about this. What strikes you first there, Bobby?
Well, I would say that the origins or the of chiropractic don't have the greatest um, start. But as she says this, it's so easy to just pick on any profession if we want to do that. I mean, I'm sure if I knew enough about structural engineering, I could just totally make fun of how they've done some things in the past or how other countries have failed and buildings have fallen. But with medicine, it's super easy. I mean, we had like James Garfield die, the president of the United States die because they didn't believe that Lister's point about like cleaning your hands or sterilizing instruments was real. And that's only like 150 years ago. That's almost close to the same time that chiropractic started, is you had the leading physicians of the time just jamming their fingers into Garfield's bullet hole wounds in his back, trying to find where the bullet went on the wrong side of his body the whole time. The bullet's on the other side. Meanwhile, he's dying from the inside out by just filling up with pus and infection and everything else. So it's like bloodletting, and you could go on and on and on bashing medicine, but it's kind of ridiculous to do because in a way it's the best they kind of knew. I mean, there's some falsity to that because you could say, well, they should have listened to Lister, but anything that's new, that's groundbreaking is hard for people. It takes time for it to set in stone, to prove itself. So it would be just so easy to sit here and just talk bad about medicine. I could talk bad about medicine today, contemporary America, like
Oh, yeah.
7 minute appointments. You're not fixing anybody. Like, oh, your BMI is 40. Let's just your blood sugars are high. Let's just put you on metformin. Let's to control your diabetes. Let's put you on some kind of GLP agonist so you can start to lose weight. I mean, all these things are like not fixing the problem, like she just said. Not they're kind of covering them up a little bit, masking them. Now again, do I feel like this about medicine? No. I know it's not perfect, but I know it's difficult. It's a business, especially in this country. It is a business. Hospitals are a business. Even hospitals, like the things that are saving lives, are also a business. And you can feel it, like somebody who's lived out of the country for a long time and come back. I can feel the business nature of medicine here, but I still support medicine. I still support like the brilliancy of a lot of medical doctors out there, but I can easily bash them. I can easily bash physios that are just using ultrasound and e-stem and hot packs all day long on every patient, doing nothing for the real cause, the root cause like she's talking about. But I'm going to send it back to you. But I'm saying, like, yes, the Palmers were crazy. I think one of them tried to kill his other brother with a car because they wanted to fight over who started chiropractic, and the origins are ridiculous. And I don't know about you. I don't subscribe to the fact that the nerves, I know they are connected. Like we know we open somebody up, you can see nerves innervate things, but it doesn't mean like if I adjust, T5 that your spleen starts to do its job better or anything. That is not what a lot of chiropractors, and I'm not going to say all of them, but I would say still it's moving, just like people caught onto the fact that we need to sanitize things and we need to sterilize things. It is catching on that, okay, maybe the roots of chiropractic are a little, off aim, but I think I'll throw it back to you, but we'll get into why I think chiropractic is still relevant and why it's still a field. And by the way, doctor doesn't mean that you're a medical doctor. You're a doctor if you're a doctor of philosophy too. You're just called doctor. So we're not ever, I don't think anybody's claiming to be a medical doctor. If they do, that is slightly, misrepresenting.
For sure. And I mean, we have that every year when we do our continuing education. You're not allowed to say, I'm a doctor. You have to specify, I'm a doctor of chiropractic. You can't mislead in advertising and stuff like that. So there are laws around that. A couple things just to start with the origins of chiropractic, and then we'll kind of move on. The Palmers were nuts. But also in the beginning of chiropractic, I love medical history, like obviously you do. Like I've studied medical. There's a book called there's the history of neuroscience, and it goes through like all the ancient ways that they figured stuff out. A lot of stuff was figured out during wartime, and they were able to try new and crazy things because people were dying, and so they were able to invent things. But yeah, and that's how things moved on. Also, there's that famous quote that science progresses one funeral at a time. And so it's the same
Hmm.
thing with chiropractic. Like, so back to the origins though. Yes, BJ, DD, they had some crazy things about them. But looking back at them, they also stole a lot of stuff from osteopaths. A.T. Still was a very famous osteopathic doctor who had a lot of ways that he worked that osteopathic medicine still works with. And he basically kind of copped A.T. Still's stuff and then just kind of slapped a different label on it
Hmm.
and kind of just gave it a little rebranding, we'll just say, right? And so that idea that like so what she's talking about is where chiropractors believe that adjusting, this is the claim that she's making her whole post rests on basically. Chiropractors claim, this is her words, basically, chiropractors claim that if they adjust the spine, you move a joint that will free a nerve, and if that nerve can flow freely, then you will be healed. That's kind of the basic presumption about chiropractic. And there are a lot of chiropractors. I went to a continuing education here last year, and all of them believe that, as far as I could tell. And so there's a lot of chiropractors who are still in that mindset that like I just need to get your joints moving, and then if that joint is free, then that nerve will run free, and that nerve will then conduct this central power in your body that will restore and heal, allow the body's natural healing properties to take over. That's kind of the basic presumption about chiropractic. And there are some half truths in there, right? Like there are definitely times where I'm sure there's somebody listening now who's been to a chiropractor and got an adjustment and felt better and felt that, they tried pain, they tried ibuprofen, they tried pain pills, they tried muscle relaxers. Then they went to a chiropractor adjusted them and they got so much relief. On the other hand, I'm sure there are plenty of people who have, if not themselves, have heard of somebody who went to a chiropractor, got adjusted, felt better for an hour, a day, 3 days, and then their problem came back. And so I think as our profession develops, like any profession, as you're talking about medical professions, engineering, computer science, technology, politics hasn't advanced that much, but
We
election
regressed.
so we've regressed. But but in chiropractic, the reason that I was drawn to chiropractic, and I'd be interested why because I know you understand the origins of that, and I know you're a more logical thinking person than I am. But I thought, okay, I see the issues with Western medicine. I see the faults in that. There's a post going viral right now, and I sent it to you the other week about this. MIT neurosurgeon who was doing spinal surgeries and found and had an epiphany after 10 years. And he was like, I don't think what I'm doing is actually fixing people. In fact, I think he said it in his post. You can see if you search MIT neurosurgeon, it's got millions and millions of views now. He went to like the Himalayas and he's having an existential crisis that he would do these surgeries. He would do them perfectly, but they wouldn't also fix the root cause. And so, we've been talking about that in chiropractic for a long time, that these surgeries aren't actually fixing the root cause. And then there are also times where I send people out for surgeries and they do get better. I've also sent people out for surgeries. I had a string of patients a couple months ago. Honestly, it was like 10 patients in a row. It was crazy one week. All the patients were about 10 years out from their spinal surgery. So their spinal surgery lasted about 10, they got 10 years of relief, which is great. Anyways, I think there's more nuance to it. But what drew me to it was that it's not the traditional Western, I want to say materialist, but like narrowing in of the problem onto one small specific joint, and rather looking at a more holistic or more global way of how the patient is suffering in pain. And that idea in itself is great. And I kind of got over the like adjustment is just going to free a nerve. And, I do believe the joints need to move. I do believe the joints are a real part of people's pain syndrome. But again, thinking from a holistic point and not a small point, I think that's the problem that chiropractors get trapped into, is they still get this myopic view of the person that if they just free that joint, they just allow that nerve to heal, then everything will take over. The longer I do this, the more I see that it is a broader spectrum, the biopsychological things that happen in a person's life, the habitual things. If you've listened to this podcast for 1 minute, then you know that we've talked about the multifactorial things that people need to do to get better. So I fully agree with her. The baseline that the chiropractors thought of, adjusting a joint, freeing the nerve, it's very limited in what it can do. It can't help some people. It probably won't help most people. But what has kept me in the profession this long and still searching for ways to help people is that there is a holistic way, a non-reductionist way to fix a person's body that requires a great consult, a good question asking, a great history taking, and then a proper treatment plan based on the pain that they have and then the goals that they're trying to get to. So like it's just more nuanced, and just to say that it's a pseudoscience right out kind of just rubs me the wrong way. But I get why she would say that. You know what I mean?
Yeah.
Yeah. But
Yeah.
let's go on to the next part. Let me play it again and go to the next part. We can kind of get into that because there is more here for sure. Okay, so
Why am I only just learning that chiropractors are not real doctors? Yeah. So chiropractic is a $15 billion industry, and it was invented by a guy named D.D. Palmer who thought that ghosts were telling him to create it. They believe that the joints and the nerves that go through our body are the cause of every ailment that we know of. Unfortunately, chiropractic is a full-on pseudoscience. There are certain chiropractors that maybe stay in the lane of more physical therapy, and there's a little bit of data to suggest that for certain types of low back pain, chiropractic adjustment can offer temporary relief, but it's not fixing a musculoskeletal problem, and it's definitely not doing the other things that chiropractors claim to do. So if you see the abbreviation DC after someone's name on social media, that means that they're a chiropractor and they're not a medical or scientific expert. Why am I only just learning that chiropractic?
Okay. So to the part where she says that chiropractors are not experts. This is another part that I disagree with wholeheartedly, and I'll explain why, and then I'd love to hear your take. And chiropractors do this kind of line of argument as well. Chiropractic college, most chiropractic colleges, and there's differences between different chiropractic colleges, but the general line is that the first 2/3 of chiropractic college are almost identical to medical school. And so like we have to do embryology and, We have to have the organic chemistry 1 and 2 and anatomy and stuff. And where chiropractic college differs from, say, medical school, then we even do like pharmacology and toxicology, or we had to. But where after pharmacology and toxicology, medical doctors will go study the more internal things, and we study the musculoskeletal system at large. Or at least my college did, Texas Chiropractic College in Houston, where so we sort of do become experts, or we're meant to. And I think there's also a continuing education thing. Medical school doesn't give you everything that you need. It just gets you in the door to pass these board exams. But we do have a better education on the musculoskeletal system. And like I've talked to some there's a friend of my father-in-law is like a world-renowned knee surgeon in San Antonio. He invented a particular knee surgery back in the 80s. And he will tell you, I know everything about the body, like halfway between the femur and the shin. Like I know everything about the knee and nothing else. So even like world-class orthopedic surgeons will be like, I know about knees, and that's it. And the longer, even if you go into try to help a person about knees, you realize the foot and ankle matter, the hip matter, the gait cycle matters, all of these larger movement problems happen. And so I think even when doctors become experts, they become experts in the internal physiology of the body, the pharmaceutical and toxic parts of the body, the internal workings, whereas chiropractors, I do believe, are more experts on how the musculoskeletal system works. And that's also what kind of drew me. I don't know. What are your thoughts on that part?
Oh, I have a lot of thoughts on this. Well, the first part, this actually always rubbed me. Even I was a chiro student and I was in chiropractic school, and they would constantly like you get these new. They did it to me when I came to what's it called when you visit the school, you come see if you want to go there.
Yeah, yeah,
You
yeah.
you know you visit different chiropractic schools and see where you want to go, and they would show you this like graph of like the amount of hours that we spend in all these different things like radiology and pathology and compared to medical school. And it's like we actually spend a little bit more, or but it's about the same, but we have a little bit higher in radiology and some other areas. And I was like, this is actually a ridiculous point that you're trying to make because this omits the entire residency aspect of medical school. Like once you finish medical school, then you go do like 7 more years of your specialty. So if you say, well, we do more hours than medical school for radiology. Yeah, unless you want to be a radiologist, and then they do a billion more hours than we ever put in on radiology. So, because
Right.
if you're going to be a neurosurgeon, it's 10 more years, like after you finish medical school. I mean, these guys are like studying and working in their area for, another 1 or 2, 3 times the length of chiropractic school or medical school. So the argument's ridiculous from that aspect. But when you now if we talk about things like I just never liked that argument because I'm like you guys you're just forgetting this little aspect of doctors where they go on to residency and we don't. We just
Right.
go out into the real world and we start treating people. They go to school again for a really long time with attending doctors that watch them and monitor everything they're doing. And so anyway, and they have more tests and more tests and more tests. And if you're, so, but with that, yes, I would say when you look at doctors and you talk about like things like nutrition or like gait cycle, they're like, uh, I might have had a day on gait cycle once, like in term 2 in medical school. Like they don't know. They don't even like orthopedic surgeons don't know. Like it's not their area. They know how I mean, they know unbelievable amount of information on like the coarctation of the arteries around the hip and how not to do surgeries here and when you have infections and how to split that femur to put a rod in there. Like it's amazing what they can do actually. But then when you get outside their area, yeah, it drops off dramatically. Even if you take something basic, like my one of my best friends just came back with a some issues with his liver on a blood test. And the family doctor's like, well, I'm not really sure why so I got to send you to a hepatologist. It's like he can't even begin to start working on his liver issues himself. He's got to send it off to somebody who specializes in the liver to see, well, we don't really know for sure. Let's ask somebody who does this all day long. So, like you said, the specialization is so intense that if it even deviates slightly from what you're good at, it falls off. Now, I would say the people who actually have the expertise in general on how the body works in the musculoskeletal system is, I would say, is probably more physios and physical therapists, and maybe even people like athletic trainers and coaches than chiropractors. Now, I'm not talking about really brilliant chiropractors that just take it upon themselves to keep learning and they love to move themselves and they're movement practitioners themselves and they study gait on they're reading, movement by Thomas Michaud on their own time. But when you come out of chiro school, I do not think you're like necessarily a musculoskeletal expert personally. I don't. I think but you have just as much of a ability or right than any other field to be an expert in that. You know what I mean? So like, like Stuart McGill, he's just a professor. He's got, he's a lab guy, but now he's known as like the greatest, the most well-known spine. Is he the top spine expert? Probably not, but he's perceived as that. And that's because he's done a lot of amazing things and he knows a lot of stuff and he's tested a lot of things. And so you can always become the level of expert that you want to become, whether you have physio is your degree or your diploma on the wall is kind of irrelevant in some regards. Where I think chiropractic shines, before we log off too, I do want to talk about why I think chiropractic is still relevant and will stay relevant despite the charlatan of the past and the origins and the quackery at some level. But oh, what was I? No, I just lost my spot of what I was saying.
Experts.
Oh yeah,
Stevie, go.
thank you. So what I do think chiropractors are uniquely good at, uniquely, is like palpation, like their ability to feel things with their hands. This sounds weird, but where a lot of physios spend a lot of time memorizing the 9 month protocol for post ACL reconstruction rehab. So they know on week 2 you got to be here, and month 2 you got to be here, and you progress from this to full knee flexion by this date. We're not that good at that stuff. And physios and PTs, they also have to learn things like cardiac rehab and stroke rehab and a lot more medicinal stuff or inpatient stuff than we do. But we spend most of our time just like feeling patients, and it's not something you can study very well. And I'm not saying it's got great inter-rater reliability, but like if it's just like who grab random chiropractors and feel what feels tight, and those studies don't really pan out, but they don't disprove my point at all to me. Like I think if you take a chiropractor and say like, you know where can you feel the psoas in here? Can you and you tell them the same technique and you ask the patient, can you feel that they're on the right spot? And you give it to somebody like a medical doctor or even like a physio who doesn't do a lot of hands-on stuff. The chiropractor will feel it the easiest. On average, the chiropractor, like you do build this sensorial like ability when you just like massage therapists probably get this too. They just lack some of the deeper knowledge on maybe how the body works and functional and a lot of the deep study that we've done, but they can feel it. They maybe don't understand it all and how it all connects and how it relates to gait or whatever the athlete's doing, but they can feel it. They can feel it. They just don't understand maybe why it's tight or should it be tight or is it good that it's tight or etc. So I think that is something very unique to muscle workers, and I would say chiropractors if you have the highest education that works within muscle work in general. Not to say that PTs can't be just as good, but in general, and I've lived in I've worked in 3 different countries, and I've noticed this throughout this kind of trend. But then you ask a chiropractor like how do you take a PCL surgery post, and they're like, oh, I don't know, we'll just adjust L5. They don't have a clue. So we have our strengths, we have our things, and maybe you'll want to touch back on that, but I don't want to forget this point of like why it persists is like, for one, if it was pure quackery, it would phase itself out. It would just die off. It would just, nobody's getting relief. The research says it's BS. Origins are BS. Doesn't work. And she, and for her point on research too, she really just gave one flat line as if that covers all chiropractic research, which there's, hours and hours and hours where you could talk about this. It tends to be better in acute care, though, is what is for sure what the research shows. But anyway, one of the things I've found is that patients do not rise to the level of the demand of what they should do. This
Hmm.
is you say, I'm 400 pounds. I need you to lose 200 pounds. Like, patient, I need you to lose 200 pounds so you can get your life together. No, I just kind of like pizza too much. Just do you have like, can I just go on the diabetes medication? You know what I mean? It's like there's so many. When I got out of school, had more of that egotistical like. When you get out of school, you're either a chiropractic student. It seems like you're either going to be the person who's super illusioned, like you believe it all. You're going to cure everything with nerve function, or you're going to be disillusioned. This happens. I think it's probably 90-10. 90% of chiropractors, they drink the Kool-Aid. It's all in the spine. Thomas Edison was right. Hippocrates was right. And then you have the 10% on the other side who are like, this is all BS. You can find some of these chiropractors on Instagram. Chiropractic's BS. None of it was real. I regret my education. Blah 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 blah. That a pure disillusionment, right? But and when I got out of school, I really quickly went more to physio PT style of treatment. But I also had a little more cockiness of like how ridiculous some of the things we were taught was, or the origins of chiropractic, or and then you start to like almost be that person who bashes the straight Cairo. Like I'm the Cairo who's figured it out. I believe in the real evidence-based care, and this is ridiculous that we only adjust or 3-minute visits or you're seeing 50 patients a day is absurd, and you talk crap about your own field. But then after 10 years and realizing that you spend an hour with a patient and explain everything to them, work on muscles, show them exercises, and at the end they're like, "Hey, can you just crack my neck though?" Like, and then you're like, "Yeah, but you came in for like knee pain. Why would I crack your neck?" You're like, "Yeah, but could you do it?" And then you're like, "No," because it doesn't relate to the problem. And then they don't come back because they just wanted you to crack something. And if that's the only thing they do for their health, is to go in and have a chiropractor feel things and crack things and make, whatever the chiropractor thinks that they need. That's something. And it's better than nothing, probably. And that's the same thing as just giving somebody metformin or giving somebody a statin because they're not going to change their lifestyle. It's no different than just saying, like, well, at least you go to the chiropractor. So I used to not like these high volume straight chiropractors, but now I'm like, there's a whole population of people that need those people because they don't do anything else. They don't do their home exercises. They don't listen to you. They don't show up for visits. They do, you know what I mean? There's the great patients that will do anything you say, but there's a subset that do nothing that you say unless it's just something easy for them or something palliative that they enjoy. And people enjoy their chiropractors. So they will live on, and they serve a good purpose. And whether it's fully, realizing what the patient needs and maybe blowing some smoke and believing some non-truths, yeah, they're rarely causing. The only time I have a problem is when they fail or refuse to refer out, when people are not getting better and they're asking for more. That would be the time where I'm like, you are morally wrong in this case now because you're still saying you have the answers for every patient that comes in the door when you don't. That was a
I
long
fully
rant, but there you go.
No, no, it's a great rant. I want to talk firstly about why I agree chiropractic will not die. And it's a little bit, I fully agree with your point, and then I want to go back to the expert part of it. But the first part about why it won't die, and again, most of the chiropractors that are working and licensed today are snapping necks and cashing checks. They're doing the flying seven. Like if you go see them, no matter what you tell them, you're going to get basically the same treatment. They're doing the same treatment protocol all day long. And by the way, that also happens on the physio side. Like Bobby and I worked for a company that did exercise and rehab, deep body work, and there was a protocol. And most of those guys just did a different protocol. And maybe it was a little more, it casted a broader net perhaps than just manipulating a joint, but you still get stuck into this sort of framework that this is the protocol that is going to fix everybody. And I think both Bobby and I have been disillusioned from this. Like, I agree that the physios that memorize the ACL protocol for after rehab, great, fantastic. Those things are absolutely necessary. There are markers at week 6.5. You should be at this number. That's great. But what drew me to chiropractic was this sort of abstract, higher looking thing. And one of the things I agree with the patients who are like, I just want my neck popped. The longer I get into it, the more you hear the patient's intuition. You know what I mean? People know their body needs something. They may not have the full knowledge to describe precisely what their body needs, but people have an intuition. They're like, I just feel like it needs to pop. And if you can give them that and then show them that there's also more that their body needs to do, and that what you do actually is helping them, and they can kind of buy in. This is actually what consent to treat means. This is not who's that famous Noam Chomsky, manufacturing consent. Like that's kind of what the rebranding kind of has done. They just manufacture consent, and people are like, okay, got it. Yeah, my nerve is trapped. I need it to be freed. So they manufacture consent. But if you can manufacture a relationship of consent where you are both on the same page, and well, you'll tell people, look, this is what I am capable of. This is the menu of things that I can offer. And if we get to a point that these things don't help you, you got to go see X, Y, or Z. I think that is the appropriate way that the medical community should work together. You should be addressing your nutritional deficiencies. You should be addressing your daily activities. But the hands-on point that you make is so crucial because like the laying on of hands, if you will, like I know it has a religious connotation to it, but and I know that people can get super woo-woo, but like being able to put your hands on another person and validate what it is they're feeling. If you've ever been with a person, if you've ever worked with a patient and they have a knot or a tight spot, they'll go, "Do you feel that?" They want confirmation, something deep in their psyche knows or doesn't know. They need some sort of validation. Yes, that area is tight. Yes, that is not normal. This is what's happening on the left, and this is what's happening on the right. This needs to happen. Now, the intervention for that may be different, right? Like the cure for their problem may not be what they're looking for, but simply validating a person's problem can unlock so much peace for a person. Like the majority of the problems that people suffer, there are people with incredible high pain tolerances. I'm sure that people watching this are like, I can deal with all sorts of pain. It's usually the confusion about what the heck is going on in their body. And if you can give them some sort of about, hey, yes, there's something wrong here. And you're correct. I do feel that. And then if you can slowly kind of elaborate that onto what is wrong, and then if you can fit as to what is wrong and what the cure for that is, what the treatment for that their problem might be, is huge. That mental aspect, you said doctors, we kind of brushed past a lot of things you said in here, like doctors on average medical doctors spend 7 minutes with their patients. They go in, the nurse does all the workup, they say, hello, how you doing? They do a little talk, and then they write them a script and they say, have a nice day. We'll see you in 3 months. And then if it gets worse, then maybe they'll refer out. But yeah, most family doctors don't have the time. They're seeing 40 patients a day. They're already behind. They're in a rush, so they don't have the time. So simply having a patient be able to sit with the doctor, ask them the questions that Google's not answering for them, that social media is not giving them the precise answers to, having someone look them in the eye, put their hands on their body, move them around, do some tests, confirm or deny things is massive in terms of patients finding relief and getting over their problems. And I think that is one of the main reasons that, if you talk to some people, people love their chiropractor. Like in some of these small towns anywhere, chiropractors are like their family. And it's good to have a medical expert who you have a rapport with, right? And that you can bring them things that like are confusing to you. Like if that's the only service that chiropractors gave was an outlet for people to express their problems, have them validated in a meaningful way, then and maybe they don't fix them completely and totally, but that mental unlocking, there's something psychological where they go, okay, you're right. I'm not crazy. There is something, my neck is doing this weird pinching thing, right? I think that psychological benefit will keep chiropractic alive long enough until we realize a more appropriate treatment measure. Because yes, I agree with her. Just adjusting the spine to free a nerve is not the answer. But I do think that psychological benefit is massive.
Yeah, I think too, if you're considering, if you're thinking about going to somebody like chiropractor too, of course, if you go look at their bio on their website, it says they're like fix everything and they're specialized in everything and they were magna cum laude and all that stuff. But if you want to kind of see if they fit for you, one thing would be like, well, of course, are they talking about things that you care about, like rehab or sports or just getting adjusted? But asking when you call, like, how long is the new patient visit and how long are the follow-up visits? Because that'll give you an idea of what they focus on. So if it's a 20-minute new visit and it's 5 minutes after that, they're pretty much just the straight chiro. And the exam is a kind of arbitrary almost. They're probably just going to make sure that they're not going to hurt you. And then they can just adjust you. And then the person's like, oh, they have a 30-minute follow-up or hour follow-ups. That might be what if you're into that, you say, I want somebody to really look at me. I want people to take time, put hands on, get that kind of deeper, you know, evaluation and connection with the provider. I think, you were talking about this idea of spending time. This is a true story just from a couple months ago. My sister-in-law, she fell, her dog like was pulling, walking her dog and she tripped over a root and fell on her knee. Said my knee really hurts. And I said, well, based on your story, it's like it's totally okay to go see a professional. She's about 2 or 3 hours from me. So I was like, just go see it. If you're worried about it, if it's not really getting better over the next week. So she went in, saw an orthopedic surgeon, an orthopedist, and said, well, ACL looks fine. I think everything, I don't anticipate the collaterals and all that. And she called me back and told me that. And I was like, what about the PCL though? You fell on the front of your knee. Why is he worried about the ACL? And she's like, he didn't mention the PCL. And then my question is, which I've asked many, many patients through the year, is did they touch you? And the answer is usually like either no, or it was like, well, it was just one thing. And she's like, yeah, well, he like bent my knee. And I was like, that's it? Yeah, that's it. I was like, okay, so you can drive here. So she drove to see me 3 hours, for me to do all these tests. And I was like, it looks like your PCL is compromised. But I spent 1 hour minimum. And I'm only looking at the knee here. But I'm checking again, comparing the other side. She had an ACL reconstruction on the other side. Is that part of the issue? Well, let me just see if I'm feeling what I think I'm feeling. After an hour, I go, I think your PCL is compromised. It's not a full rupture because it does have a tautness at the end, but it's giving too much. It's probably like a grade 2 PCL strain or sprain or tear. She goes back and she just wanted, she's got a wedding coming up. She's really concerned about how she can do this summer, what she should do. She still goes back and demands an MRI. And only then that orthopedic surgeon says, okay, we'll do the MRI if you want it. And comes back grade 2 PCL injury. And I was like, if you just, and it's like, I could so in that case, am I the right person? Should people never go to orthopedists? Because I spent the time, I put the hands on, I had the right diagnosis. Luckily, I don't know in this case course not. Like or if you ask me to repair the PCL, that person is going to have really really bad outcomes. Okay, so but the point is like we all physios, PTs, chiros, osteopaths, naturopaths all serve a purpose, and to the individual, someone is much better suited than another one. Like I tell my patients, like, listen, if you have another clone of me, but my clone is like a serious avid runner and I've ran my whole life, nothing else is different about us, and you have a running related injury, you want to go to my clone. You do not want to go to me. So there's somebody out there that's suited for you best. And it's like, that's why chiropractors are important, and they're not all the same, just like all PTs are not the same and all medical doctors are not the same and all surgeons are not the same. Just watch a few documentaries on surgeries on surgeons on Netflix and you'll find that out. So that's it. Like I just think, yes, we come from a charlatan background. We have some not so wonderful reputation on a lot of things. But but chiropractors still serve a pretty good purpose, and as long as they're honest, I don't have a problem with like the role that they serve in society, and sometimes it's a really good role. So
Yeah, I think the final point before we log out, and I would love to hear y'all's comments on all this, what's your experience with chiropractic, what's your experience with medicine, because the biggest thing, and maybe it's just an American thing, but we seem to fall in a ditch on one side of the road or the other, where people go, I don't want surgery, I don't believe in medicine, I don't believe in pills. Specifically, in 2020, there was a worldwide medical thing that caused a lot of people to be very skeptical about the medical expert advice that they were getting. And then they've been completely disillusioned and they go live off the grid and like being a chiropractor, we see a lot of these people who are completely anti-Western medicine. And sometimes it's actually a problem for people like me to be like, at this stage, if you just get a steroid shot, you'll be fine. I'll do the things to help them and I'll be like, you just need a steroid shot in your frozen shoulder. You're in stage two.
how
It'll,
dare you?
I,
Turmeric,
it's only,
turmeric,
dude,
and badger pubic hair combination, and it'll
we're going to
all.
talk, we're going to talk about this, like the role of fascia, the role of all of these various things that people put all of their hope in is also a crock. Like try to have, if I could have one piece of advice, chiropractors do not have all the answers. Medical doctors do not have all the answers. You're going to have to find a team of people, especially if you have a complicated thing. And hopefully the people in that team are all talking to each other. I think that's the future of medicine, to be totally honest, where you are good in your thing, you are good in your thing, and we know our limits and we can send them off. Don't throw chiropractic away, and please don't throw Western medicine away. I know this person who had like died of pneumonia at 32 just because she wouldn't go get some antibiotics. Like, anyways, it's not a pseudoscience. I am happy with my career choice. I still need to grow in my profession. I still need to provide better patient care. And honestly, I think that's what we're trying to do here in the future is bring this information to you. That's part of the development, I think, of our profession is to open up the floodgates of information and allow you to make an informed decision based on your health. Because ultimately, at the end of the day, it's up to you. You're going to have to make the final call on what matters. And the fun stuff we put out on Instagram and TikTok is nice and hopefully attracts you in, but hopefully these podcasts give you a little bit more information. That's why I started Stretch Club, link below. It's a weekly stretch mobility where we work on your entire body. I believe the body needs a lot more than we kind of give it credit for. And I think, that's what we're trying to do. And this is the best we can do. But yeah, thank y'all so much for watching. Any final comments, Bobby?
No, that's it. Hope that
Awesome.
cleared some stuff up, and we'll see what people say.
I'm very much looking forward to y'all's comments and concerns. And we'll do some more of these reactions. We got some good viral posts coming up in the following weeks. We're going to talk about all sorts of stuff out there. We're going to clear the air and get you informed. So if you haven't liked, you haven't subscribed, subscribe. We'll be having more consistent podcasts coming out. We'll be talking about all sorts of stuff to get you up to date on the most up-to-date information on the medical field. We'll tell you where we suck and where other people suck. And hopefully that can be helpful for you guys on your journey in health and living a full and wonderful life. And thanks so much. And we'll see you next time.
See you guys.